This episode is brought to you by Arthrex. Arthrex is a global medical device company and leader in multi-specialty, minimally invasive surgical technology, along with scientific research and medical education. The company has pioneered the field of arthroscopy and sports medicine and develops more than 1,000 new products and procedures annually to advance minimally invasive surgery for orthopedics, trauma, and spine, in addition to arthroplasty, cardiothoracic, and biologic innovations. Arthrex is a leader in this field with a comprehensive portfolio of innovative tools. So whether you're in healthcare, curious about cutting-edge tech, or just grateful to walk pain-free, check them out at arthrex.com. That's ARTHREX.com. Arthrex, helping surgeons treat their patients better. Welcome to the Birmingham Medical News Podcast. I'm Steve Spencer, the founder of the Birmingham Medical News. We are a monthly publication. We've been doing this 21 years now. We're a monthly publication for healthcare professionals throughout Alabama as well as the contiguous southern states. And we do this in partnership with Kasuth & Company. Kasuth & Company is an accounting firm here in Birmingham that's about 100 years in business now. They do all manner full accounting service. One of our connections with Kasuth is simply they've got a great healthcare department, healthcare consulting department. They also do wealth management and, like I said, just full accounting services. Our guest today is Dr. Adam Lukasiewicz, which, by the way, I'm sure you know this, in Polish means son of Luke. Anyway, I understand you were fellowship trained in orthopedic surgery and you did your undergrad and medical degree at Yale. Grew up in Toronto.
Yeah.
Yeah. How did you end up? Well, I guess it wasn't I was thinking about coming to the States to go to school.
So I started rowing in high school. And then
yes, I saw that. Go ahead. I'm sorry.
So I wanted to keep on doing that, so I went down to Yale, and I was on the varsity crew team there for all 4 years when I was an undergrad.
And I saw that you had an injury rowing that got you interested in orthopedics.
I managed to break my clavicle biking to practice one time, my collarbone, and it was a bit of a, thankfully the time of the year worked out well, but it was a bit of a process getting back to it, and that was sort of my first experience with sort of the medical system and trainers and sports injuries, and it was sort of sparked my interest in orthopedics.
Okay, yeah, that's what I saw, and understand that you met your wife, who apparently is from Birmingham up at Yale.
Yeah, my wife grew up in Vestavia, I met her actually on the before we even started, we were on an orientation trip together, hiking through the woods.
Okay. Oh, cool.
Started dating, and now 19 years later, we're still together. But so we grew up in Connecticut for a long time. And, she got her PhD and I was out in California a bit for a postdoc, but she got a job at UAB.
Okay.
And she moved back to Birmingham, and it's been great with her family, and I followed her.
And that's got to be great too, because you just told us earlier you had an 18-month-old daughter. Mm-hmm. Having family close by is huge with a young child. Yeah.
My mother-in-law has been a lifesaver.
Yeah, that's huge. Well, obviously, I should tell folks you specialize in foot and ankle surgery, and of course, with so many people these days playing pickleball, that's just exploded in popularity. I don't know. Have you seen more injuries from pickleball players?
Yeah, it's been. I've seen a lot. And it's become a really popular sport. It's a great sport. It's a lot of fun. It's also a very social sport.
Right.
You're on a pretty small court with 3 other people. It's easy to have a conversation. It's easy to hang out with your friends. And I see a lot of people, this is their first time back playing sports for a long time. Some people who played sports in high school, maybe in college, used to be a little more active. Decide to go play pickleball with their friends and sort of rediscover a passion for sports and sort of get back into it.
Right.
But that also brings with it, people who aren't used to this degree of athletic activity, and suddenly they're really excited. It's a lot of fun, and they're playing every weekend or several times a week, and see a lot of injuries as a result.
Okay, and by the way, are there things that people who are engaged in something like pickleball can do, like an alternate sport to alternate with, that might help avoid injuries?
Definitely. I mean, I think the biggest thing, some basic just general sports, staying hydrated, stretching before playing, warming up appropriately, all big things. But a lot of it is also, understanding that, especially if this is a new sport, not something you played before, that you got to build up to it, and you can't expect to play all the time at a high level right away. Just more stress than your body can take. And so a lot of it is play with friends, but and enjoy yourself, but build up to it. And some cross training, whether it's in the pool or on a bike, some weights, and sort of helping get your body sort of acclimatized to the sport, can help prevent a lot of, especially the stress injuries.
Okay. And so I know there's a lot of different foot and ankle trauma that you deal with. So I'd like to just go through a few of them, if you can explain to us. Well, for instance, let's start with sprains. If you could kind of explain, I know we all think we know what a sprain is, but what a sprain actually is, and when somebody comes in with a sprain, your process.
So, a sprain is a ligament injury, fundamentally.
Okay.
By far the most common one is an ankle sprain. And what's really meant by that is two of the lateral ankle ligaments, the ATFL, or anterior talofibular ligament, and the CFL, the calcaneofibular ligament. The two ligaments on the outside of your ankle. And the typical sprain injury is the foot twists underneath, and those ligaments tear. And they swell, and they hurt. And they range from the, oops, I shouldn't have stepped that way, my ankle's a little sore, walk it off, to, wow, I can't walk. And there's a pretty wide range. Really, though, the treatment for them is all pretty much the same, which is a brief period of immobility to get it comfortable, whether that's a cast or a walking boot, very occasionally crutches if someone really can't walk, and then getting people in a brace and moving again. There's a lot of evidence to suggest that the faster you can get someone moving, get their range of motion back, the faster they can return to sports. So it's, it's always a balance: immobilize to protect, get the swelling down, but then, get moving again. And usually some physical therapy can be helpful with that.
And I can see if it's a function of twisting your foot, how that could happen a lot with pickleball.
Yeah, especially, we see it a lot with cutting movements. So, suddenly step to the side and just, lose balance and it rolls. And also if people jump at all, can come down wrong, and that can cause it as well.
Twist it. Yeah.
And the other goal, aside from sort of getting people back with their motion, getting some stability back, is also just preventing a similar injury again, because that ligament's healing, it's a little bit weak. And if you keep on rolling your ankle in quick succession, that can become a real major problem. So
I guess with that in mind, when somebody's had a sprain, you want them to, I guess, really lay off of it for a while.
At least until they're able to walk around comfortably without any significant pain.
And I would ask, is there a typical length of healing? I guess that would depend a lot on the severity, right?
It's one of those, everyone is different, and every injury is different. There is, certainly of sprains that come to medical attention, which is obviously the worst end of sprains, because the really mild ones you walk off and never see a doctor about. There's a study showing that about half of them still have symptoms at 8 weeks after injury. Okay. So we always think of a broken bone or a fracture as worse, but really, a bad sprain can take just as long to heal.
And what about an Achilles tendon injury? First off, I know who it's named for, the Greek warrior, but I don't know exactly what an Achilles tendon, I guess a tear, is exactly, and what the function of the Achilles tendon is.
Yeah, so the Achilles tendon is the big tendon in the back of the leg that attaches to the heel.
Okay.
It's the biggest tendon in the body. It's very thick and strong. And there's sort of two different versions of Achilles injuries typical see in pickleball players. One is Achilles tendonitis, where the tendon gets inflamed. Still intact, but it really starts to hurt. It can hurt in the tendon itself, or it can hurt in the back of the heel, right where the tendon attaches to the bone. Okay. And that's sort of a chronic, repetitive motion injury where it just keeps on pulling, and the tendon is trying to heal. It can't really do that, and it gets inflamed, and it keeps on pulling. Okay. And so the Achilles' main function is to push off. So every time you take a step, you push off with it, and particularly if you're pushing off to go chase a ball or to move side to side, you're using your Achilles, and that's why it tends to get inflamed and it tends to hurt.
I can totally see that because I play pickleball myself, and it is a lot of short bursts.
It's a lot of sudden explosive movements, and you get that every time you push off, you're using your Achilles to do that.
Right, I didn't know that because it's a relatively short court, and if somebody, dinks one just on that, you've got to push off really fast.
Even if it's one or two steps. You're sort of on your toes, ready to push off, and it's a pretty big force, and it's that repetitive force.
Are you seeing a lot more of those? Like pickleball seemed to explode 3-4 years ago. Have you seen a lot of these various ones a lot more since then?
Definitely.
Okay.
And especially for the tendonitis version of it.
Okay. Of Achilles.
Yeah.
Okay.
A lot of that is most people spend their day sitting.
Oh yeah.
When you're in their office or sitting in their chair at home, and the gastrocnemius, which is one of the muscles in the calf, which actually goes past the knee, tends to get tight. And so most people have a pretty tight calf. And basically the Achilles is, it's a tendon, but it sort of acts a bit like a spring, and it's a little overwound. And so when it's tight, it's constantly pulling on the tendon part. And so a lot of the tendonitis, certainly see a lot of it with pickleball players, is just because the calf is too tight. Okay. And really for that, properly stretching out the calf so that the tendon is not quite so tight can help a lot. Okay. The other side of the Achilles stuff is Achilles ruptures, where the tendon just splits in two. And that's sort of, there are risk factors for it. Some antibiotics can do it, some other things. But really that often happens when people go to make an explosive push. They're lunging for something, they're trying to push off hard, and the force is just too much, and that tendon rips in two.
That's got to be really serious.
It's a pretty major injury. Yeah. It's interesting because it hurts terribly for like 15 minutes to half an hour. Okay. And then it usually stops hurting. That's okay. But people just notice they limp. They can't walk the way they're supposed to. They try to go take a step and they just have no push off because the Achilles is no longer hooked up and they can't push off the way they're supposed to. But the pain goes away relatively quickly, which is interesting.
Yeah, it's a little surprising.
That's an injury that is usually treated by surgery.
I thought it would almost have to be because you've got to. Don't you have to basically sew it back together? You
basically need to put the tendon ends back together. Yeah. There are some new surgical techniques to do that, which are sort of neat, that involve passing needles percutaneously through the skin. So you need a little incision, but much less than a traditional one. Okay. That's a surgery that does pretty well. People, you put up together and people, heal and they get back to their activities. There is a pretty long rehab with it, though. I mean, it takes a while to get all your strength back.
Approximately how long would it be?
Really, it's usually somewhere between 3 to 6 months before you're really back to playing sports at any kind of real level.
Okay.
There's a bit of a controversy with one of the NFL quarterbacks a couple of years ago who claimed that they were going to return to football sort of right afterwards.
Who was it?
It was Aaron Rodgers.
Oh, okay. And I didn't realize he had a tendon. Okay.
But he was throwing passes on the side, but it really, at the end of the day, it took a whole season to really get back
to playing. That. Okay.
And it really does, in terms of actually getting back to your full level activity, it really does take quite some time. Okay. There actually are some possibilities of treating Achilles tendons non-operatively. But there's some good research showing it can be done, and there's some protocols to do it. But it's pretty challenging because you need to get the ends of the tendon back together really quickly.
Okay.
And so by and large, most times when people tear their Achilles, by the time they get to see an appropriate, physician, it's sort of past the point where you can do that and usually end up needing surgery.
How in the world would you get the ends together without having to essentially sew them? How do you, in the world would you do that?
Essentially push the foot so the toes are pointed down as far as possible,
Okay.
which sort of shoves the tendon ends together.
But wouldn't you... Okay, but if they're torn, wouldn't they just, as soon as you put your foot back up, they just open back
So
up?
you sort of, there's a whole protocol where you sort of cast them that way for about 2 weeks to try to get the scar in,
Okay,
and then
I
just
see.
slowly let them start moving it again.
I see. Okay.
Historically, the main benefit to surgically fixing Achilles tendon is the risk of popping it again is lower if you fix it.
Yeah, of course.
If you do it's a little controversial, but there's also probably a little better push-off strength if you fix it.
Yeah.
But the vast majority of certainly athletic patients who are having a sports injury pop in their Achilles are going to want it fixed surgically.
Yeah. Yeah. Well, that's interesting. What about fractures?
Don't see too many major fractures in pickleball. The two ones see the most of are fifth metatarsal base fractures.
Okay.
It used to be called a Jones fracture. So that's a small bone on the outside of the foot.
Okay.
And there's a tendon that attaches there. And there's also a bit of a weak spot where the blood flow isn't great.
Okay.
So the same kind of injury that can cause a sprain where the foot rolls, depending on what the position of the foot, can cause that bone to snap as well.
Okay.
There's sort of two versions of it. One does fine with a walking boot and some time. The other one often needs to be fixed surgically just because they don't heal that well by themselves.
I was going to say, because there's not much blood flow to that area, that would impact the healing.
Yeah, the blood flow to that bone is interesting. It comes from each end, and it tends to break where they meet in the middle. And so there's just sort of poor blood flow from both sides.
To that spot,
Yeah, often fix those ones with a screw.
Okay.
And that usually lets people get back to sports pretty quickly.
Okay.
The other fracture, see a lot of stress fractures.
Okay.
And so, you can't see them on an x-ray. They're not, completely broken. But every day when you walk, your bones are living things. They get little cracks, like, the crack on a wall. Not so much so broken that they're falling apart, but if you're looking under a microscope, you can see the little cracks. Your bones are living. Your body patches them up every day, and as long as those two, the breaking down and the patching back up, are in balance, it's fine.
Okay.
When you get a stress fracture, basically it's too much breaking down for the body to handle. So those cracks keep on accumulating. Your body can't patch them up fast enough, and eventually you have a significant crack that stays there.
Okay.
And that's a stress fracture. And really, it's an overtraining injury. So it's doing too much, too soon, too much force on a bone that your body can't accommodate for it, and then it starts to hurt. And eventually, if you keep on going, you can see a true fracture from it. Most of the time, it hurts enough that you stop doing what you're doing, and eventually it doesn't go away. You end up seeing a physician.
And what's the surgery for a stress fracture?
So
How does that work?
Thankfully, they don't need surgery most of the time.
I'll be darned.
And so most of the time, some rest, immobilization, avoiding whatever was causing it in the first place till it heals, is enough to make it better.
Okay.
A lot of people are vitamin D deficient too. We get vitamin D from the sun. Most of us spend our days with clothing on indoors and don't get enough sunlight, especially in the winter. And so sometimes some vitamin D and calcium can help as well. Very rarely do they ever need to go on to need surgery, but they mostly get better by themselves.
Okay.
But really, the biggest thing with the stress fractures is fundamentally it's an overtraining problem. And so the fix to them is to give them rest, but the long-term fix is to change what you're doing in the first place. So usually it's a sign that you're doing too much too soon. So when you get back to activity, build it up gradually. Don't go back to the same level that you're doing to get the injury, because you'll get the same injury again. And cross training is really helpful for that too. So especially activities that aren't weight bearing, or less weight bearing, like biking, swimming, lots of weights, that kind of stuff, and that can really let you be active and keep your fitness up without putting the same stress that's causing the problem.
Okay. And with pickleball, do you see any or many plantar I always have trouble. Fasciitis?
Plantar fasciitis, yes,
Fasciitis.
All the time. Okay. Yeah. So terrible word to pronounce with the two I's together.
Yeah, I stumble over some words. It's just the way it is.
It took me a while. It's part of my daily life now, but it took me a while to get that one too. I see a lot of plantar fasciitis, which is a really common problem generally.
Okay.
That usually manifests as pain on the bottom of the heel.
And that's a pickleball injury as well?
You can get this from anything, but see a lot of it in pickleball in particular.
Okay.
And sometimes the plantar fascia starts in the heel, it goes up to the toes, and so most of the time it's in the heel, sometimes it radiates out to the toes.
Okay.
But it's actually very similar to the Achilles stuff that we're talking about earlier.
Okay.
A lot of people have a very tight plantar fascia.
Okay.
And so when you're sort of, when you're getting ready for a shot, you're sort of bouncing around, on your toes, that's putting a lot of stress on your plantar fascia. It's sort of pulling on that ligament right at this where it meets the bone, and it tends to get inflamed.
Okay.
And if it stays tight, it keeps on pulling on it, stays inflamed, and it keeps on hurting. And so very similar to the Achilles, if you can stretch it out, get that keep it stretched out, much less likely to have that kind of pain. Because it's often described as a stone bruise. It can be really painful, and it can stop you from doing what you want to do. And aside from stretching, there's lots. If you go online, you can find a million solutions to plantar fasciitis.
Oh. Okay.
Everything from inserts to various doodads you put in your toes and all sorts of things. The good news about plantar fasciitis is it usually goes away.
Oh.
So to some degree, if you give enough time, almost anything works.
Yeah.
But really, stretching is by far the thing that's most likely.
I imagine stretching probably helps with a lot of these.
That's
avoiding a lot of these injuries.
A lot of sports injuries. Being warmed up, stretching out. If something starts to hurt, address it before it becomes a big problem is helpful for most of these things.
Yeah, I would think so.
The other thing you see occasionally is a plantar fascia tear.
Okay.
Where the plantar fasciitis is inflammation, but it's still intact. The tear is like an acute. Basically, the ligament partially tears.
Okay.
That's usually really painful, and usually people go to push off and they just hear a big rip in their foot.
Oh man. Okay.
And that's one that you need to take seriously. Usually a boot or a cast, and stay off it for a while. And that's usually pretty obvious. It's not subtle.
Yeah.
To the point where your partner probably knows it happened too.
Okay.
Sort of, you can tell something happened.
Yeah. Not only from your motion, but also I imagine if you can actually potentially hear the rip.
You could probably hear the
rip.
Yeah.
That's got to be scary to hear a rip like that.
Definitely.
Yeah. Well, that sounds great. Is there anything you should add that I haven't asked?
I think those are the sort of most common ones. The other one I see, which makes it sort of in the same vein, is tennis leg. And obviously pickleball is not tennis, but it's in the same sort of vein of racket sports, which is a strain of the medial gastrocnemius, one of the muscles in the leg.
Okay.
And that often sort of sometimes feel a rip, but often just feel pain sort of up in the inside of the leg.
Now, what part of the leg is this?
So it's the gastrocnemius muscle. It's one of the one of the muscles that goes down to make the Achilles. So it's a muscle up in the calf.
Okay.
It actually goes across the knee too.
Oh, okay.
So it affects both the knee, but it's pretty common, especially people who are pushing off, lunging, to get some injury there. And actually, see a fair bit of it in pickleball. The good news, as far as injuries go, it's something that tends to recover pretty quickly, as long as you take it seriously, and protect it.
Is there much with those sort of things? Are there much you would do besides just inactivity? I mean, does ice help or heat? Does anything?
Initially, most of these things, ice helps. And most people have a bag of frozen peas somewhere in their freezer. That works great for most foot and ankle things. It sort of you can sort of mold it to fit pretty well. But yeah, ice, elevation, putting it up, Tylenol, Motrin are sort of the mainstays of most of these problems. And the vast majority of time, that's enough.
Okay, well, that's good. That's good. I mean, so a lot of these you can just take care of just by
a lot of these things are
things.
Yeah, I mean, it's sort of the rest, ice, compression, elevation, the normal stuff. And the vast majority of injuries get better. One challenge I've run into is there are a lot of people who are really into pickleball right now, and convincing them to take a week or two off,
they don't want to do it.
It's surprisingly hard.
So it gets worse.
And so that is one of the things with this is taking it seriously, and for your long-term health and for your ability to enjoy the sport.
Yeah.
When you have an injury, take it seriously. Take some time off, let it rest. If it gets better, great, return to sport. And if it doesn't, that's when you probably need to see someone about it.
Yeah. So I guess a lot of people, because I imagine if you got the injury and it doesn't hurt, it does hurt, but you keep going, you're going to turn something minor into potentially something serious.
Yeah, and certainly there is the potential for making it worse.
Yeah.
Making it what should be a relatively short-term problem into a long-term problem.
Yeah.
And also just delay the recovery. Instead of having a nice, smooth, transition back to playing sports, doing this sort of yo-yo, I feel good, I play, I feel bad, I stop, and that can sort of be this perpetual cycle of never really fully recovering because you won't give your body the time it needs.
Yeah, and I can really see, because it's crazy. I don't even know where pickleball came from. I literally ran across it the first time. Must have been 4 years ago, I think. I was at Herdmont Park, and and Herdmont Park has some tennis courts. And as I was walking past the tennis courts, I saw some really small courts. I'm like, what is that? And then I saw guys playing, and from there, all of a sudden, it's everywhere.
It's really exploded.
Yeah.
And it's a great sport. And one of the best things about it is you can play it pretty casually.
Yeah.
If you just sort of want to rally with your friends,
right,
it's easy.
Yeah.
I have some cousins who take it really seriously, and they're in tournaments every weekend, and it's a really competitive sport, and it works really well for all that.
But you as you just said, you really can take it casually, because I played tennis when I was young. And tennis, you've got to cover, it's usually almost always singles, and you've got to cover a lot of ground.
Yeah.
Here, it's pretty much always doubles, and you really don't have to cover much ground.
No, if you really want to lunge for that extra point, you can.
Right.
And if you want to watch the ball go past you and see how to pick up the next one,
you
can do that too.
Right.
And it's also nice that, you're on the court with a bunch of people, and you're all in pretty close proximity, where if you want to chat while you play, it's pretty easy to do.
But I would also think from what you do from your practice, because so many people playing pickleball, it's all ages, but you got a heck of a lot of middle-aged and well past middle-aged folks playing. So I can only imagine, I would assume that your foot and ankle injuries that you see have really
it really has
gone up a lot.
Definitely.
Yeah, I would think so.
And some of it is people who have always, the sports like, tennis or something before the pickleball was always part of their life.
Yeah.
And some of it's really people who are, finding, athletics again.
Yeah, which is great.
Which is fantastic.
It's really good for their health.
It's good for their health. It's good for mental health. It's it's a great social activity. But I think a lot of people still remember the last time they were playing sports regularly was 40 years ago, and they still feel like they're 25.
Yeah.
And sometimes it takes the adjusting to the realities of life can take a minute. And so I definitely see some injuries where people just still thought they were 20 when they're lunging from a ball.
Lunging from a ball that you might have just as well let go past.
You're not playing pickleball for money.
Yeah. Well, that sounds good. I guess hopefully we've. Hopefully, if I hadn't missed anything, again, let me know if I have missed something.
No, I think that's the major. That's what I've actually seen a lot of it. But those are the major injuries that I've come across.
Well, sounds great. Well, thanks for coming in. I think it's interesting, and again, somebody who does this plays it as well. I've learned some good information too.
Well, thanks for having me. I appreciate the opportunity.
Yeah, sounds great. All righty. Well, thanks. Thank you for listening to today's episode of the Ask the Doctor podcast. brought to you by the Birmingham Medical News and Kasufin Company. Please make sure to like and subscribe, and make sure to tune in for our next installment. I'm Steve Spencer, and wish you and your loved ones a healthy journey until we see each other again.